Hi, everyone. Welcome back to Beyond the Bedside. My name is Betty Long. I am the founder and CEO of Guardian Nurses Healthcare Advocates. And with me today and always is Rebecca Czarkowski, my colleague and friend here at Guardian Nurses. Hello, Rebecca.
Hello, Betty.
Hello.
Hello.
This episode is about blood pressure. I know you're all riveted by the fact that we're going to talk about blood pressure, but it's a very important issue in the healthcare field. Together, Rebecca and I have 62 years of healthcare experience, so we know upon which
a thing
we
or
speak.
two about blood pressure.
And it is I'd say, number one or number two topic that patients and our clients want to know about. When we have health fairs, always want to have a blood pressure check. There are always patients who present with high blood pressure, and most of the time, patients and families don't understand what the numbers mean. And that's what we wanted to talk about today, so that you have a better understanding of what your blood pressure is. So,
do you have high blood pressure?
No. I do not.
No.
What are you insinuating? No, I don't.
No, I do not.
Only certain times of the day. No. How about you?
Well, I don't think I do. So when I am not at the doctor's or getting care, my blood pressure is fine. But every time I see a doctor, or if I'm in an ER, or my blood pressure comes in high.
Do you know what that's called?
Yes. White coat syndrome.
White coat syndrome. And why?
Because we get anxious when we're about to receive health care.
And we see a white coat coming. Even though it's usually not the white coat that's taking the blood pressure.
Right.
It's usually the nurse.
Or the blue scrubs.
Or a technologist or someone in the office. They don't typically have a white coat. But way back when, I guess doctors, of course, got white coat syndrome, right? They named after. So it's a heightened anxiety, which then raises your blood pressure.
Yes.
But it doesn't stay that way once you leave the office.
Correct. And I do check it because I think, oh my gosh, if that's my blood pressure, I could have a stroke.
Correct.
So I get nervous about that. Then I go home and I take it manually as opposed to automatic. And I'm good. But I think that, to your point, I don't think people, even in healthcare, recognize that that's a real event that happens to lots and lots of people, that they have white coat syndrome, or that you should have both legs planted on the ground and you should just relax and leave your arm planted instead of up in the air holding it up. There's so many variables to getting a good blood pressure.
We know that blood pressure is important because we're nurses. But why should our listeners be concerned about blood pressure? Talk about why it's the number one or number two vital sign.
Okay, so it involves your entire circulatory system and your heart, and how well and effectively your heart is pumping. So blood pressure can lead to, we know, cardiac events, stroke,
kidney disease,
eyesight issues, headaches, even, blood pressures in different organs will also, we think of high blood pressure, just your normal blood pressures, but there are pressures coming out of your kidneys, and that really impact how your body as a whole is balanced. And so when your blood pressure is running high or low, it will impact a lot of how you feel. And sometimes it's so insidious that I feel like people don't even realize, because they're living in that moment of having high blood pressure chronically, they don't think they feel bad until they realize that it's corrected.
It's called the silent killer, because people don't realize often that they have it. And when we go to a health fair or to an event with our clients and we measure folks' blood pressure just off the floor, hey, come on over and take a blood pressure, it is sometimes very high, and they say, well, I thought that number was the one. So I don't think folks realize what the numbers mean, right? And the American Heart Association has changed the parameters for high blood pressure, what constitutes high blood pressure. It used to be 130/90. Now they've lowered it to 120/80. So let's talk about what those numbers are. There's two numbers involved in blood pressure. One is the top, one is the bottom for most folks that look at a blood pressure. But the top is the systolic and the bottom is the diastolic. And those numbers matter. And most folks think the top number matters.
Is the biggie, right?
And it's actually the bottom number.
That's more of an impact of your cardiac function.
Right. And
right.
Why?
We'll go back to the top number first. Why the top number, it might not tell us about cardiac function, but the top number is what is heavily impacted when you're stressed, when you're in pain, when you're nervous.
When you've had too much coffee.
When you've had too much coffee.
Or see a white coat coming in.
Yeah, right. So it matters. I'm not saying it doesn't matter, but that pressure, that number is related to other physiological impacts than your bottom or diastolic blood pressure. And that diastolic blood pressure is telling you basically how effective that your heart is pumping, I guess is the best way to put it. And if it's high, it indicates your cells, right, are having to work harder to pump the blood through the heart. I want to do this at the most remedial.
Well, I had I don't know whether it was a nursing instructor or maybe it was just another nurse I worked with, because I was in the cardiac unit. And they often refer to it for patients about plumbing, right? Because your vasculature is your plumbing, your body's plumbing. And the plumbing, the pressure of pushing out blood from the heart is the top number. And the bottom number is when your arteries are at rest. So think of plumbing. If there's a lot of stuff clogging your system, right, clogging your pipes, there's going to be a higher pressure in the pipes at rest, which is no good. You want to have lower numbers when it's at rest so that the blood can flow more freely. The top number is when there's a system pressure on it, right? So there's water rushing through the system or blood rushing through your arteries. And you would expect with caffeine, with stress, it would go higher. But then when you're not stressed, when you're not drinking coffee, it goes down and it's less. So it's 110/60, right? So something to think about when you have your blood pressure checked, and we'll talk about the best times to measure it, the best way to measure it, because that drives me nuts. When you go into a healthcare facility, whether it's a doctor's office or an ER or urgent care, and they slap
any old cuff on you.
Right. They slap any old cuff, which is not proper. I mean, in nursing school, this was one of the first skills that we learned, and it took forever
to really learn
it, right? And they wanted to make sure that we did it right, that it was proper, that everything was okay, and that we actually, back in the day, I know I'm a dinosaur, but back in the day when you actually listened with a stethoscope to somebody's arm when you were taking a blood pressure. Now, a lot of the blood pressures are taken by Dynamat, which is that machine they roll in and slap on and hit a button, right? So nobody's actually listening to the pulse come back. So it's really kind of cool when we were in nursing school that we learned this, and it was like a badge of honor to be able to take a blood pressure.
Absolutely.
And
manually,
right? So the equipment for folks at home, there's a lot of equipment that is for sale in the pharmacies and Amazon, right? So how do you take your blood pressure at home?
I do.
Right.
Manually.
And you use a automatic cuff or a manual?
I use a manual cuff. Okay, so I know I'm a medium cuff because I'm in the business and I know what size fits me, and I'm also able to physically take my own pressure. So I understand most people are not, and most people are going to have an automatic cuff that they either get from their local pharmacy or, Amazon. And so
or online.
They're not terrible. I'm not trying to insinuate you wouldn't get a good pressure from them, but it's extra important then that you have the right size cuff and that you're sitting the right way and you're taking it at the right time of the day and not rushing it and fitting it in. And often checking both arms, because you will
Right.
see, which Betty, I'm sure we'll talk about a little bit, sometimes you have very different pressures in both arms. If you're laying down, sitting up, or standing up, you'll get very different blood pressure readings. And so the best baseline is to have both feet planted on the ground, take some deep breaths, relax, and then let your arm relax and just let it pump. Don't hold it up like this. Don't, have a stiff arm.
And why is that? Because you're constricting, right? And so that's going to constrict the vessels. You're holding your muscles tight to hold your arm up, and it's squeezing.
It's going to impact
the vasculature,
mm-hmm.
right? So I think that's what people need to understand, is that it's not one measurement that should rush you to urgent care or to your doctors. It's repeated measurements. So if you do go to the doctors or urgent care and they say that your blood pressure is high, and maybe they recommend that you take your blood pressure at home, you should take it over at least 3 measurements, right, over the course of, say, a week.
Yeah.
And if those numbers, hopefully they give you parameters, but if they're over 130/90
regularly, consistently,
you want to write them down. You want to write down what time: 8 a.m. on Tuesday, 130/90, take it on Thursday again, 7:30 in the morning, it's 140/94. You're trending dangerously up, and you would want to report that back to your healthcare provider, because that's not a great blood pressure to have. 110/60, 110/70 is great, but high blood pressure is the number one. Heart disease is the number one killer in our country, and high blood pressure is included in heart disease, right? Because what Rebecca said earlier, stroke, right? Think about the pressures in the arteries leading up to your brain. If they're
squeezing,
tight, not good for your brain, right? Not good for your heart, not good for your kidneys, because arteries supply blood to all the important organs. And that's why blood pressure is such an easy diagnostic tool for you to take and measure yourself. I know some friends who take it, they're a little bit...
Oh, crazy. Yeah, don't take it too much.
Not so.
Don't take it too much.
Because you're going to see inflections in your blood pressure, right? In the morning, after you've gone to the bathroom, take it, because you have all that fluid in your system from sleeping. So go to the bathroom, sit down, lay down, take it next morning. You don't have to be every 15 minutes or every hour, because you're going to see different variations in your blood pressure just based on what you're doing during the day.
And if you don't have a means to check your blood pressure, I think this is kind of important. What would you feel like? What are some of the ongoing feelings that people have when they run high chronically? And it's funny, it's not what you would think. A lot of people say they feel sick, like they just always feel like a little jittery or a little sick. Headaches, visual disturbances. Some people report feeling like they clench their jaw a little bit, almost like they're tightening when they're not tightening anything. We have patients who say that when they're low blood pressure, people who run low, they might feel dizzy. When they stand up, they feel like they're going to fall. So we always teach people, particularly if you don't know what your blood pressure is or you don't have the means to check it, always get out of bed slowly in the morning, put your feet, let them dangle, and then stand up. And these sound like silly little recommendations, but I can't tell you how many people we get in the hospital and in an ER and urgent care who fall getting out of bed because they have they drop their pressure is what we call it. But when you're going from sitting and your blood pressure is good and you stand up really quickly, or from laying and you stand up really quickly, the pressures just drop really fast. And so people can have reactions.
And you're not getting blood to the brain. Because you're sitting, all your blood's pooling, and then you jump up, and your body can't calibrate fast enough to get the blood flowing. So you feel dizzy and occasionally fall.
So Betty, tell us a little bit more about the bottom number, the dreaded bottom, the diastolic pressure.
The diastolic. So diastolic, diastolic, in case you're looking it up. The diastolic number is the number that is really, I guess, more critical to maybe getting on medication, right? That's the one that is pretty much the pressure at rest. So while your top number can go up with activity, with stress, with caffeine, with fluids, your bottom number pretty much stays the same because it's the pressure at rest. So your arteries are not doing anything, they're just there. And that's why it's a more critical indicator of what is called hypertension, high blood pressure. And that number is, it could be 90 and above. I mean, I know the American Heart is saying 80, but I think people are trending up.
Yes.
So I think anything over 80 consistently, and certainly over 90, and definitely over 100. Because we've seen patients come in, as Rebecca said earlier, to a health fair who feel fine and have felt fine. No symptom at all. And when we take their blood pressure, it's surprising, like, oh, are you feeling okay? Because your pressure is 160 over 110, which is dangerously high. And we often send those folks to the emergency room and promise that they'll go to see their physician because that's a pretty high blood pressure. It's indicative of really the vasculature is not flowing, the blood is not flowing properly through because there's such a high pressure to get through, right? And that's just going to cause chaos for your brain, for your heart, for your kidneys, and your eyes.
So something though, a side note about blood pressures and fitness. So as we're sitting here talking about ranges and what is considered high and how things go low, one thing that we know is that if you're athletic, like an athlete, a runner, you really challenge your heart and your cardiovascular wellness. We often find those people have very low blood pressures and very low heart rates. And so when I am with a patient who runs super low, that's one of the first things I will ask is, are you a runner? Are you a cyclist? Are you a crazy iron person? So that is not a scary low. That low is because they are so fit and the muscle of their hearts is so strong and it is pumping so efficiently, requiring less blood flow to circulate through the body. So it's normal if you are a very healthy, fit human being to have lower blood pressures. That is your normal. Just like somebody who might run 120 over 90 or 89 all the time and have run that way for years, they might say, this is my normal, this is where I am. And what we're saying is, talk to your provider and make sure they want that 90 or that 89. They may want to do something, fish oil or prescription or something to get you down into the low 70s and 80s, because as we age and put more stress and burden onto our body and heart, we want it to have to work less to give us the same benefit of having your circulatory system working.
We have a lot of people are on a lot of blood pressure medication, a lot, right? But there are ways in which you can, sometimes it's called essential hypertension, right? You have it. There's nothing you can do. It's genetic. Your parents had high blood pressure. You're probably going to have high blood pressure. But for the folks who are not having a genetic issue, there are ways potentially that you could help yourself get a little healthier. Talk about that.
Well, I mean, so not to sound cliche about a diet and sleep, but let's just talk about the diet first. Things that you can just keep away from that we know impact blood pressure, regardless if you run high or low. Canned foods, right? High sodium, frozen pre-made meals, high sodium, salt, any, processed foods are chock full of salt and sodium to keep it fresher longer. And so that is one thing that is fairly easy to really cut out of your diet. You do not have to add added salt. There's alternatives in the spice world. I've only eaten Mrs. Dash since I was seriously, it came out when I was 14 years old, and my mother's mother, she had terrible high blood pressure and high cholesterol, and she was a cook, and she got rid of salt and used Mrs. Dash when it came on the market. She swore by it, so now that's what I use instead of salt. So that is one thing that's an easy adjustment, knowing we're human beings. Obviously, we all have our food things, but that is something pretty simple.
Right, and it's not, I want to say rocket science, but getting outside, taking a walk, right? Trying, if you do have stress in your life, trying to manage the stress, getting out into the fresh air, meditating, reading, getting enough sleep. The things that we suggest for people to get healthier is not really
that big.
That big. It's challenging in our world because we're
Yeah.
inundated with stress and things to do, and taking the kids to this team and this sport. But at the end of the day, you can help yourself if you don't have the genetic predisposition. That is,
Yes.
in fact, where you should really know your number. Get your blood pressure measured at some point.
Know your numbers.
Know your numbers, right? Just get your blood pressure taken and write it down. And if anybody asks next time, say, could you take my blood pressure? The other thing I want to say is when folks do take your blood pressure in the healthcare system, ask them what it is. I've been in situations where they take my blood pressure and then they just
walk out of the room and you're like, okay.
Like, wait, what was it? Right? I want to know. And maybe it's because you don't know what the numbers mean, but now you do. So ask what the number is. And if you don't understand, say, is that good or bad? Right?
Yeah.
Is that good or bad?
And then go to the American Heart Association. They have online on your phone, and they have terrific resources, tools. All right. So I think what we should do here, Betty, is give a little, like a little bulleted list for people to think about when they're.
To your head. Is that where it's at? The list is
in my head.
Okay, good.
And we're not writing it, so it'll be a bullet in their head, a bulleted list in your head.
Right. So the top number is
systolic.
Systolic. SYSTOLIC, if you want to look it up. And that is the number at the pressure, at exertion, right? That you're exerting pressure on your arteries in your body. The bottom number is
diastolic.
Very good. DIASTOLIC, if you want to look it up. And that is the number at rest, which is, I think, and I'm not a physician or with the American Heart Association, it's the number that is the more concerning number for many people. That number is at rest. So if it's above,
if you're running, if you're I would say, if you're running high 80s or 90 over a few days, you can talk about how frequently again. But if you're checking over the week and keeping a little journal, not like a crazy person, and you're getting high 80s every time, I think you should see a primary, because there's opportunity there to be ahead of the curve, and instead of it going higher, let's bring that down as you're aging. That's important.
And your healthcare provider may suggest certain methods to do it. What we talked about, just getting out to walk, changing your diet, right? Losing weight, not smoking, because smoking will constrict the arteries, so that's no good.
Caffeine,
right? But really, the healthcare providers want to help, so it's an easy test. It's really, if it is a vital sign, so just make sure you get it measured and at least know it. It doesn't matter, because sometimes children can have high blood pressure too, and that's a concern. So always at least have one blood pressure measurement.
And if somebody was going to do it ongoing now, like, oh, I heard Betty and Rebecca, and I think I'm going to check my pressures 3 times a week, do you think is?
Yeah, I don't think you have to do it any more than that, even once a week. If it's running normal.
It's more than now.
Right, there you go. It's more than you're doing now, right? Go out for a walk, get some fresh air. Thank you for joining us this episode about blood pressure. We hope that our conversation did not raise yours.
Thank you. Bye, Betty. Bye, everyone.
Bye.